Generally, I treat adults who have problems with their hip or knee. That could be arthritis or a wide range of other diagnoses where they're having trouble getting around or functioning. I primarily do replacement surgery, whether that's a first-time hip or knee replacement or a revision surgery. I'm particularly interested in complex and revision surgery from the anterior approach for hip replacements. That's something that was pioneered here at Yale back in the 70s. Something that's important about my approach to patient care is finding out or getting to know the patient and what they're missing out on. And that helps me to understand what I can do, what I can offer to get them back to doing what it is they want to be doing. You know, the surgery itself, it may be an hour long, and that surgery is very interesting and engaging for me. But when you see the difference that it makes in that person's life afterwards in the clinic, when you talk to them, it can be quite profound, and I find that very satisfying.